All right, so for this, we're going to do the video for a CT adjustment. We're going to start with motion palpation. So to start with, I'm going to be checking the first rib on either side. So I'm going to contact the top of the patient's head, just push S to I, making sure that these first ribs are not superior. And I'm going to have the patient put their arms up on their shoulders like this and put your elbows together. You find if you open up your gum. I'm going to reach around, contact the elbows, and then I'm just going to be using a fist and pushing P to A to check for any extension restrictions in the thoracic spine. I'll have them lean forward, check for any flexion restrictions as well. And you can keep your hands right there. I'm going to reach around and use the thumb contact. I'm going to check for any rotation restrictions. And I'll do the same thing on the other side. So if after that we found that T2 was right rotated, I'll have the patient lay face down. So from here, we're going to be using our caudal hand as the contact hand. I'm going to be using a hypothenar contact on T2's transverse process. So I'll go find T1, C7, T1, go down to T2, slide over onto the transverse process, get a hypothenar contact on there. This is an assisted adjustment, so I'll have my patient turn his head to the left. And then you can either stabilize their head there or reinforce the contact and have the patient take a deep breath in and out. You're going to follow that breath down and you're going to be pushing straight P to A. Patient is prone and you're in a modified fencer stance as you're delivering that thrust.